Hello, good morning everybody. So today it came to mind that I will do a video of more like laid back, like telling you how my day's going and maybe joining with tomorrow's day, because it's gonna be full of clinical work. So I'm probably gonna spend most of my day in the clinic. It's 9:46 already. I have done a little bit of work in the morning. I had my breakfast. I did a check-in with one of our professors because we do check-ins every once in a while to see how we're doing. And now I'm gonna start the IQ, which is the cases that we do from 10 to 12, and then I'll have to be in the clinic at 1:30. I do have a full schedule, a lot of things to do. I'm already falling behind on lectures, but I'm trying my best. And in this video I'm also going to show you how I plan for an exam, because I have an exam next Tuesday and it's Wednesday. Right now I'm just finishing having my coffee and I'm gonna read a few things before we start our case. Our case is on ulcerative colitis and Crohn's disease. So to make sure that I know everything about that, I'm just gonna read an AMBA's article on it. And yeah, that's going to be it for now. So update, I did finish my IQ session. It went really good. We covered those two inflammatory bowel diseases, and my mom came. She helped me out around the house, and that's always really nice. So now I'm preparing my to-do list for the rest of the day so that I feel kind of like I have a plan. I feel a little bit like pushed right now because of time and because I have an exam on Tuesday, so I have to see how everything fits. Plus I have like 2 or 3 assignments that I need to do apart from that are not related to the exam, so that needs to be done also within today and tomorrow. So yeah, that's the update. I'll check back with you later. Okay guys, so let me turn this off. I'm here already in the clinic for preceptorship and I'm running a little bit behind, so what I'll do is that I'll catch up with you guys after I get out so that I can talk to you about my experiences today. I have my white coat and everything ready, and we'll just head in and see what the day has to offer. Hi guys, so I just finished my preceptorship. I'm here outside the office. I had 2 patients today, or could see 2 patients today, because here in the clinic we take our time, and since it's a little bit slower, I can only go with 1 of the residents at a time. So even though they see more patients, I only see 2 because I can see one at a time. So I worked with 2 residents today and with our preceptor, who's a doctor, that attendant that goes with us afterwards to make sure that our plan is good. I practiced my soap or presentation of a patient once with the first patient, and it was really useful to just practice and see how it comes out naturally without I just chose to do it without being nervous or anything, because it's a really safe environment there, which I really appreciate. I think it will prepare me better to do presentations for patients and in the more fast-paced of the hospital. So I really enjoyed today's clinic. And yeah, I had the first patient. She was coming up for a follow-up because she had a UTI infection with proteinuria and blood in the urine, leukocytes in the urine, and she went to the hospital. And she's coming for a follow-up with urinary frequency, and we just examined her and asked the full history, physical. So yeah, it was really interesting to see that case and like connect the patient to what I have studied, and see that she used the medications that we've studied. And the second patient was she's coming because of a meniscal tear that she had in the medial meniscus, and also her pressure was really high, so she had uncontrolled hypertension that we needed to change some medications for, and also refer her to the orthopedic surgeon for the knee, which has been progressively getting worse.
and it was a lot of talking and explaining and make sure the patient knows what to do in preventive medicine, which I really enjoy, to just practice talking to patients about that and digging deeper and have a little bit more time, right? So yeah, it was great. I really enjoyed it, and right now I'm going home to plan for the rest of my afternoon, which I do have to work a lot. It's not free time.
Hi guys, so right now I'm home. I put my hair a little bit up because even though I want to maintain it in a decent manner, it's just when I can't have it on my face. I have my food, which is what's keeping me up right now because I'm really tired, but I know how to continue, so I'm gonna eat first so that I get some energy. Your brain needs glucose, not too much, but it does need a little bit in order to be efficient. And of course I put bananas on everything. If you've seen my vlogs, you know. But this is my food for today, and I'm just gonna hang out here and watch a video while I eat, and then we'll get to work. So I just finished my lunch, and I was just watching a video about study techniques and things like that for med students and just for doctors and physicians that practice medicine. And I like to watch this channel that's in Spanish. It's called Tutorías de Medicina Interna, and they are both students from Colombia, and they make videos. They have their own independent channel. So I was watching Andres, who is one of them. Santiago is the other one that I'm also subscribed to him. But they're just amazing. They're like so intelligent. So Andres has a Spanish channel, and what he was talking about, just doing summaries of whatever you learn. And in the recent era of technology and all of these things, medical students and residents, everyone tells me that notes are for nothing and you shouldn't be taking notes and whatever. But I see a value on it, and I get what he's saying, that if you have a summary of whatever you're learning, if it's the first time that you're being exposed to that content, it's important to have a summary that doesn't take you much time, but it will be like your second pass through that material, and that summary is going to serve you throughout your career, because whenever you have a patient with that condition, you're going to go back to that summary to like prompt your memory from whatever you have done before, and it does stick. So I think Anki and doing flashcards and doing questions, that's important. That's super important, and you should incorporate into your studying. But also incorporate some of the old style techniques of doing summaries of the material, especially if it's like a very dense lecture that you don't really understand. You need to break it down into your own understanding. It's useful to have your own summary that you can then say, oh, this one I did it. It's not just copy and paste, but I did it. I put my time into this, and this is how it sticks. And this may not be as efficient for like exams, because it takes time, but for me, in my case, I do it with only some of the lectures. I see which ones need this, which ones don't. For example, the farm lectures, I do more Anki based studying, because it's more like memorization and things like that. Or like anatomy, I will do Anki because I have to know the structure based on what I see. Histology, I do Anki. Any imaging, like radiology, I do Anki. But when it comes to understanding a concept in its own, like for example, I don't know, neoplasia of the lower GI, I will do a summary, because that will serve me forever. And it's not as good for exams because it takes time, but it's good for your future learning. If you have a patient like that, if you have a patient that presents to you with this, you don't just want to know like the most common presentation. You want to know the different things that the patient can come up with that will help you in the diagnosis, and you want to know the why behind things. And it's important that you write them not in your own words, but that you do the effort yourself to write those and to come across that clinical understanding, instead of just having 11,000 flashcards. So I agree with that, and that's a good tip. So I just wanted to mention. Now that I'm here, I'm just going to take the time to show you. I wanted to show you what I bring in my bag for clinical days. So I take this small bag with me for anything that I need, and I do bring my stethoscope in my white coat, but apart from that I do bring my iPad, because if I rarely have downtime, but if I have downtime, I can use my iPad to look things up, or look a certain disease, or look some lab values. I have my iPad and today I brought my camera so that I can do the little videos for you in the car. But apart from this, I bring a little notebook. This is just my little journal that I use to write literally anything. And for example, I have written the normal lab values, and that way it sticks, because if I write them a lot of times and like I see how this relates to the patients, and if the patient had any abnormal lab findings, I can go ahead and compare really quick to this. I also have a little like a template on how to do the soap note here. Really, like, just write anything and everything that I think is necessary. So that's why I bring pens with me. One pen that you can erase with, and just another normal pen just in case. I want to show you. I bring these notes. Give me just one sec. So these are my templates that I use to see the patients. And I use them now because I'm a first year medical student, and I just really need to make sure that I'm not missing anything. And sometimes when the residents are asking questions, or if I am doing the history, I want to make sure I have all the answers pertaining to social history, past medical history, etc. So I have this template where I can also put their vitals, their name and age. And then I use the blank part, which is blank, to write their physical examination and their HPI, because for the HPI I don't have the questions, I just know them by memory. So I just ask the question, put them in the back, and then write my plan, also what I think I'll be doing for the patient in the back as well, so that when I'm going to see the preceptor, you know, like at least I have an idea of what to tell them. I bring my clip for my hair, just in case. I have another clip on right now, but other times. I bring my own blood pressure cuff, because some of the ones in the clinic may like be faulty or may not be working at that time, or it just they're old and they just slip off. Well, I want to have mine just in case. And this one is just a regular one with just the old way of measuring the blood pressure, which I know how to do just with my stethoscope. And I also have tuning fork and this, what's it called? This stretch reflex thing. So yeah, that's what I bring. And sometimes I bring water. Something else that I'll show you that I bring is this note. This is the vaccination requirements for different age groups. This is really important, especially in a primary care setting where you're looking for things that you can do for the patient as of now, to prevent them from getting anything, including COVID and the flu. So you see here which vaccines they're due based on the age. Also, another thing that I recently included in my tools is a nutrition history. You see, many patients are having trouble with what they eat, either if it's diabetic patient or a hypertensive patient, or any patient in general that's having like a hard time with their food. They don't know how to control their nutrition, and they feel fatigued, or they don't know how food influences their overall health. I can ask a general, I get more in-depth questions about their nutrition. And this I got from the American Academy of Family Physicians, and it will give me an overview of what they eat, for example, for breakfast, lunch, meals, if they eat fruits, juice, vegetables, high fiber, things like that. So I like to ask if it's a patient that's struggling somewhat with the sugar, or struggling with fats, hyperlipidemia, things like that. It's good to ask these follow-up questions so that you understand what's their problem, if it's something like social related about their job, or if it another kind of problem, so you can guide them like that. I'm not gonna stop using the templates if I would say I have to for now. And I know in the OSCE we're not using any templates at all, so I have to get used to that. My OSCE is gonna be in May, so I have to prepare for that. Good morning, everyone. So yes, it's the next day. So yesterday I just did a lot of studying, a lot of catching up, and like I looked crazy, so I didn't want to film and just like continue the video today, which we have also an exciting day. It's already 9:48 in the morning. All I did was continue on with my to-do list from yesterday, doing the neoplasia lecture and some firecracker quiz that was assigned for us to do. My school like gives us some quizzes to do every week, and now I'm getting ready to start the SCP session. If you've not watched my vlogs before, SCP is the sessions where we learn the practicing aspects of medicine. And for example, today we're learning about professionalism and professional boundaries, and I'm guessing they're gonna talk to us about how to act in a professional environment. Not that we're not professional already, but I think it's just extra advice and tips from doctors that have gone through it, through this and have experience. I'll show you what I had for breakfast because I put it on Instagram, so I have the clip for that. But I was just studying and getting ready and just getting my life together because I've been waking up late and I just need to change that. I have my sleep hygiene is not the best at this moment, so I just had to adapt. And yeah, today we're gonna create the exam plan for this couple of days that we have left before the exam. So yeah, I'll check back with you when I finish this session. Hi everyone, so just update on my day. I wasn't able to vlog too much because I was falling behind and I had to do a lot of things to get ready for my clinical skills session, which was from 3 to 5, and now I finished, but I do have my to-do list for the day. It's a lot of finishing up, like the neoplasia lecture, AMBAs, questions, some emails that I have to send, and also the vascular and diverticular diseases lecture. So that's what I have for today. The clinical sessions went great. It was a shoulder pain kind of it was shoulder, elbow and neck pain case, so we have to write that up, the complete full write-up, and I will have to present that next week. But for now I just have to focus on preparing for the exam, which I have on Tuesday. So that's what's going on for now. I couldn't vlog that much. I had, before the clinical skills session, there was a preparation kind of session, and there was a rheumatologist there, and she explained we went through some cases, and she explained a little bit of the pathophysiology, and I really enjoyed it. So that's actually another possibility in my list for future specialties. And I sent her an email to see if I can chat to her, see what the day of a rheumatologist is like, and I go from there, because it's on my top list of specialties along with neurology. This is really interesting. There's a lot of immunology involved. The patients have chronic conditions, and you're like their family doctor for these patients, and you can really help them with the new medications that are coming out. So yeah, I'm really interested in that as well. And right now I'm just gonna study, eat, and I'll check back with you later. Okay guys, so it's 9:37. I can't even talk anymore. I'm so tired. I just wanted to close the video here, and thank you so much for watching it. I know it's a little bit random, but just thank you for still sticking with me. I promise I'll bring more organized informational videos soon. So yeah, I'll see you in the next one.